This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest edition of the Best Health Podcast. Justin Gomez here with you from Wake Forest Baptist Health. Hope everyone is staying well during this time. We are going to talk today. A little while back, we were able to talk with Dr. Jeffrey Deaton with Infertility Medicine, and this conversation is a little bit of a follow-up to that conversation as we kind of discuss and highlight 30 years of REI and fertility medicine here at Wake Forest Baptist Health. And we have a great special guest joining us today to continue that conversation, but from a little bit different perspective. Dr. Catherine Attala is joining us from our psychiatry and behavioral medicine area. How are you, ma'am?
Justin, I'm doing just great. Thank you so much for asking.
Oh, no worries. Thank you for joining us. I know you're busy. I think that this is going to be a very fruitful and insightful discussion today. Before we dive in, I do want to remind everyone that's listening, you can listen to all of our Best Health podcasts on a wide array of health and wellness topics from our Best Health page, wakehealth.edu/besthealth. Then click on podcasts, or you can simply download these podcasts from wherever you get your podcasts. And hopefully you'll find these beneficial. So Dr. Attala, before we jump into more specific questions, I'd love for you just to take a minute and talk to our listeners. Give us a little bit of a background about yourself. Where you're from, how you got to Winston-Salem, and maybe why you chose this specific career path, and a little bit about what you do day to day.
Sure, Justin. So I grew up near Wheeling, West Virginia. So I'm a mountaineer.
There you go.
I went to West Virginia University for undergraduate.
Okay.
And then I went to medical school at University of Louisville in Louisville, Kentucky, and also stayed there and did my residency in adult and general psychiatry, as well as doing a fellowship in child and adolescent psychiatry. At which point, my husband and I went to Boston, and there I was at Mass General Hospital and McLean Hospital.
Mm-hmm.
And at that point, I became interested more in perinatal and reproductive psychiatry. There's a large contingent of folks up there doing it, especially at the Mass General, very large group of perinatal and reproductive psychiatrists. So I really kind of learned a lot about the work that I do there. And then I have since brought it to Winston-Salem. We came here in 2004, my husband and I. At the time, our boys were 2 and 4, and now they're 18 and 20. So,
oh, wow.
And I am at Wake Forest in the Department of Psychiatry. I'm an associate professor of psychiatry, and also adjunctively, I am an associate professor in the Department of Obstetrics and Gynecology, period.
Okay. That is a great background overview for us, and I appreciate you giving us a little bit of insights into what kind of led you down this path. Now, we're going to be talking about the emotional impact of infertility today, and I know the broad subject of infertility can go in a few different directions from a clinical and medical perspective. But really want to talk to you today about the emotional or psychological impact of infertility, and as we go through answering some of these questions, really just leaning on your expertise of what you have experienced in your clinic and working with patients and clients over the years. So just on a base level, if you wouldn't mind just giving us a brief overview of at what point when you're working with your OBGYN counterparts and colleagues, and they're working through Dr. Deaton's department with fertility medicine, Where do you come in at what stage of coming in and talking with a patient and assisting a patient?
Basically, the both Department of OBGYN in general and also outside OBGYN docs, as well as the Center for Reproductive Medicine with Dr. Deaton, know
Mhm.
where I am. They know where I live, so to speak. And
Okay.
what happen is they will contact me with requests to consult with the patient. So sometimes I go over to the Center for Reproductive Medicine, but most of the time at this point in time, patients are coming into my office, which
Mhm.
is um, out on Jonestown Road in the Department of Psychiatry. So they all know me over there pretty much, and that's how I get most of the referrals that I see.
Okay. Now, in your experience, talk to us a little bit about what impact does infertility have on the psychological well-being for women?
It's a big question, and it's different for each woman, really, in
Hmm.
that her own kind of psychological landscape into the whole infertility arena. Um, and there are trends which cut across many women. However, the overall trend is that it's incredibly stressful. There's a life stress scale that helps people rate the degree of stress in their lives that infertility can cause. And I will tell you that infertility is right up there with death of a family member
Mm-hmm.
and personal experience with cancer. So um, it's incredibly stressful.
Hmm.
It's a type of grief reaction, really. Each month that someone is trying to have a baby is seen as another loss when pregnancy doesn't occur. And this really accumulates over time.
Mm.
So that the longer infertility drags on, the more impact on psychiatric and psychological well-being. And then also the longer it drags on, the more isolated the woman becomes.
Mm. Interesting. Well, let's flip that around real quick and talk about the impacts of infertility for the male partner, for that woman as they're going through this process.
The male partner becomes really stressed as well. However, what we know is that trends include the man being less stressed than the woman in the whole infertility journey.
Hmm.
Uh, Men tend to kind of channel their emotions and feelings about this into more activities, more work related functions, and distraction techniques. And they don't shut down and grieve as actively and as openly as their wives do.
Hmm.
I would say, though, that the one exception to this is when there's male factor infertility, so that there's an issue with the sperm, either um, uh, uh, um, access to it or quality of it or
Hmm.
number and so forth.
Hmm.
That is really distressing for men.
Okay.
So the other issue is that men have more performance anxiety than women. So there's more pressure to perform
Hmm.
if if they're trying. Um, and the other issue is that men complain more about the negative impact on their sex lives than women. So the stresses are there, but they're different, and they're different in separate circumstances, I would say.
Okay.
Women that their husbands or partners don't really understand the great pain
Mm.
and stress that they're feeling.
Gotcha. So to follow up on that, with the couples, men and women that you've seen over the years, how would you describe the way infertility impacts the actual relationship dynamics?
Mm. That's a really great question. And each half of a couple, I would say, brings his or her own set of baggage into a relationship. So we all come into our relationships with our own set of issues and our own background and our own belief systems and so forth. So it's brought into the situation of infertility as well. So, and we all deal with stress and uncertainty and difficult situations in life in very different ways, so that, if there are any kind of chinks in the armor of the relationship, that becomes magnified through the whole infertility process.
Mm.
Sexual intimacy starts to become a work obligation, or feels like that.
Mm-hmm.
So the couple's under more stress in general. They're having less fun than usual, and everything focuses on the next cycle, the next ovulation time, the next period of time where they're going to start using medications. And this, it's not easy. It's not easy for couples.
When you say it's not easy for couples, do you think that the stressors of infertility can lead to depression or depressive episode?
Well, there's a lot written on that, and a lot of thought goes into that. What we know for certain is the longer that infertility drags on, the greater risk one is for developing, say, a major depressive episode, or, a diagnosable psychiatric disorder.
Mm.
Um, there's what's called the stress model of depression in the field of psychiatry, and basically that describes the fact that if there's increased stress, which is what infertility is, it's a stressor, this gives rise to elevated stress hormones in the body, generally such as cortisol, which is produced in the adrenal gland. And those stress hormones are at higher levels, and they act on brain centers that dysregulate mood, so that this places one at greatly increased risk for anxiety disorders and depressive disorders. So the other piece of that is that infertility can be sort of intertwined with an endless loop, the depression and infertility process. The more depressed you get, the more likely you are to be infertile, and the more you undergo infertility experience, the more depressed you become. So it really, one feeds off of the other, and that's very, very difficult. You have to break the cycle somehow.
Yeah, that's interesting. That I was gonna bring that up, and I've heard about that anecdotally in the past, and just wondering about the accuracy of that. If you have these stress feelings, these stress hormones being released into your body, that actually contributes to the difficulty of becoming pregnant. That's interesting.
Yeah, because stress hormones can dysregulate ovulation. That's just one small example.
Okay.
The other piece is that infertility medications actually can increase risk for development of psychiatric disorders. For instance, certain of the drugs like Lupron and other ovulation-inducing type drugs can raise your risk for depression. They actually have direct effects on the brain neurotransmitters that control mood.
Mm.
So there are many different levels to this situation with depression and infertility.
Just real quickly, you mentioned a second ago about the necessity to break the cycle of this stress cycle. When you're talking with patients, what's a piece of advice or an exercise or a activity or thinking process that they can invoke to help break that cycle?
That's a complex question again, and certainly the downstream effect of severe stress, again, is that it interferes with all that fine tuning of the brain and reproductive system. So stress-induced behaviors definitely impair fertility. So the stressor itself may not cause the infertility, but the stress-induced behaviors can increase the risk of infertility. And that would include things like poor nutrition, obesity or anorexia, lack of exercise, or as in opposition, excessive exercise, smoking, drug use, poor sleep. These are all behaviors that people under stress are more likely to engage in. And these are at the same time behaviors that will impair fertility. So it's the downstream effects of the stress itself that can be a big culprit. And, telling women to just relax doesn't work.
Right.
It's always the temptation to just sort of tell them to just chill out and let it happen. And that doesn't work. It just increases their frustration level
Yeah.
and helplessness. So it's not really productive to say that to folks that are struggling with infertility.
Yeah, I can understand that. One other question I've had, we're talking with Dr. Catherine Atala about the emotional impact of infertility. Have you ever heard, or I'm assuming you have, how do you respond when someone, either the female patient or the male patient within the couple, do they say, why do I feel like it's my fault? It's my fault that we're not getting pregnant. We're not successful because of XYZ and it's my fault. Do you hear that, or can you share, a little bit about that?
Oh, sure. Well, within the couple, generally it's quoted that 40% of infertility is female origin, 40% is male, and 20% is partial both.
Mm-hmm.
Both men and women go through these self-blame kinds of experiences. And the fact is, Justin, we're a task-oriented, goal-achieving culture.
Mm.
So for folks in our culture, it feels like a failure. It feels like inability to achieve a goal. Aside from that, women experience many what-if questions. Why did I wait so long to get married? Why did I wait so long trying to conceive? Why was my career feeling so important that I couldn't take time to have a baby?
Mm.
Why did I make bad past decisions regarding sexual activity? And now I have these, history of sexually transmitted diseases that sometimes can impair fertility.
Mm.
So, these are all questions people ask. And then, again, if there are chinks in the armor of the relationship, there starts up to be a cycle of blaming.
Mm-hmm.
And women blame themselves, and they often will describe their bodies feeling like it's the enemy.
Mm.
So not productive when one is trying to conceive.
No, I imagine not. You just mentioned a second ago where a lot of us are we tend to move from goal to goal in this culture, and we're goal oriented, and we need to, accomplish this, accomplish that, check this off our list.
Mm-hmm.
So, a fair amount of people, at some point in their lives, they aspire to be in a relationship, and or have a child. So, maybe the infertility doesn't make them feel like they've just lost control of this process of their life plans. What I was thinking, I was going to have a spouse, 2 kids, a dog, a cat, a white picket fence, if that's someone's,
Mm-hmm.
what they were thinking about when they were younger. How would they cope with that, feeling like they've just lost control of what's going on in their life?
Mm-hmm. Very good question. So we have to help women realize that, their sense of self, their sense of self-worth and life purpose is much bigger than achieving a successful pregnancy. When you're going through this process, everything else takes a back seat. And it's sort of a joke, but it's not funny. I tell, women going through the infertility process that it's like crack cocaine. Once you start, it's very, very hard to stop
Mm.
and go on to the next level of intervention and so forth. So in order to cope with it, I help women to really figure out how they can nurture other parts of themselves, both individually, relationally, and within their larger communities. That, you can't just focus on the infertility process. It's very counterproductive. And again, it increases risks of psychiatric morbidity and lower level of functioning. It helps to speak with women who've gone through the same struggles, sharing stories and so forth. But I tell women, please be careful with all those chat room sites because they're not helpful and they actually create more stress. So, you're more than your own infertility, and women need to hear that message.
Mhm.
Because none of us wakes up in the morning wanting children and expecting not to be able to have them. It's a basic human drive, very, very powerful, very, very granular. So, and none of us expects it to happen. So there's always this shock and grief and tremendous loss.
Mhm.
The grief is similar to losing a family member.
Mm.
So we have to,
Wow.
you know, the other thing I say to folks is, control's a myth. Life control is a myth. None of us are really all that in control of our lives anyway, if
Mm.
you think about it. So really just examining other parts of this.
Interesting. That's so insightful, Dr. Atala. So, we've mentioned the stress, anxiety, and you just mentioned a couple of examples, and grief as well. So, as a couple is experiencing this grief or this loss or this stressor
Trauma.
that maybe consumes up a lot of their thought minutes throughout the day.
Mm.
What's some talking points or advice that you can give to help them process through this grief or managing these stress levels?
Mm-hmm. Really, spending time with your partner, doing enjoyable activities, things that have nothing to do with the infertility. Getting back to figuring out what you all enjoyed as a couple before all this stuff kind of took over.
Mhm.
Um, Psychotherapy is helpful. Counseling and psychotherapy to help improve coping strategies. It helps put voice to women's fears and uncertainties. And women need to put voice to that. It's because internally it just feels like a big jumble of emotions, and most of them are not helpful or productive. A big part of coping strategies involves an optimal lifestyle. There's ongoing greater research around yoga and mild exercise, not intense exercise. Like
Mhm.
you don't want to be doing cardio, an hour of cardio a day, but walking is wonderful. Yoga is fantastic, as I mentioned. Dietary changes can be incredibly helpful. The Mediterranean diet is really great. I talk to women about that in terms of eating whole grains,
Mm.
lots of vegetables, soy, omega-3s, and so forth.
Mhm.
And weight management. We absolutely know that obesity impairs fertility.
Mm.
Obese women have a harder time getting pregnant, and they have pregnancies which are more difficult, and they tend to develop more illnesses like preeclampsia
Mm.
and preterm birth and so forth. So maintaining a healthy weight is huge. Also, women who are obese don't ovulate regularly. So those are all important factors. The
Gotcha.
other, the other piece I would say is women cannot give into that impulse to self isolate. The longer infertility drags on, the more isolative women become. It's very normal in some ways to become more avoidant. Like women experience intense jealousy very often with, say their sister's already now on her fourth child, or
Mm.
this friend got pregnant and didn't want the baby. It's very hard not to feel envious.
Mm.
Women will find themselves doing things like avoiding baby showers, abandoning relationships where their children are involved. So there's a tremendous process of self-isolation, which can become very damaging as well. Um,
Mhm.
so stay connected is what I would say. Stay connected to those that you're close to, and don't give in to that whole um, desire to self-isolate. Also, I tell women, keep up with your hobbies. You had a life before you started this journey.
Mhm.
Don't just put everything on hold waiting for your next ovulatory cycle,
Mhm. Mhm.
and that's what it comes down to. Life is on hold. Nothing else matters. This is the only thing in my life that matters. And these are very common threads in the discussions that I have with women who are
Okay.
undergoing this. I tell women, you wouldn't wish this on your worst enemy. It's just,
Well,
it's loss or loss.
yeah. That sounds like a lot of great conversation and direction that you can give to couples
Mhm.
going through the infertility situation that some of them find themselves in. And you brought up counseling a minute ago, and I'm glad you did. How does one know, or maybe they could benefit from counseling specifically related to infertility and talking to a professional such as yourself?
Mhm. Good question. A lot of times the reproductive endocrinology team will recognize when women are having a particularly difficult time functioning.
Mhm.
They, most of the time, hopefully, they're trained to pick up on um, women who are struggling with depression or anxiety disorders, panic disorders, those kinds of things, and often they'll recommend the counseling. Um, but to individuals, I would say, if you're feeling anxious, you're feeling stressed, you're feeling depressed, and you're unable to manage it on your own, then therapy and counseling will help. It will help you to kind of navigate your way through this and to put things back on track. My personal belief is that everyone can benefit from therapy at some point in their lives. And this is a major life challenge, and therapy can be extremely beneficial. So if you think you might need it, then you probably would benefit from it.
So to follow up on that, speaking as the male half of a couple, and my wife and I have been married for several years, and I maybe tend to think that I can muddle my way through a situation on my own, or
Mhm.
quote unquote walk it off or shake it off, and I can just kind of manage on my own. What would you say to someone who maybe would have that kind of mindset and initially resistant to the idea of counseling, even though there's just tremendous benefit from it?
I think part of it is owning up to what's on your plate. We all have a plate in front of us, sort of metaphorically, and that plate is full of something.
Hmm.
Um, and so if your plate is too full, or if you don't like what's on your plate, then therapy can help you sort of change that emotional plate out. It helps you to put words to your feelings. It can reduce isolation. And, folks, I haven't, honestly, I haven't seen a lot of resistance to therapy. I think that people are so eager to do whatever it will take
Well,
to get past that. So, and I think most of the time when I see someone, they're very, very eager and very ready to talk about this.
okay,
So it helps to put words to your feelings. It
yeah,
just does. It helps you move forward. Sometimes folks need to make a plan B.
yeah,
They don't know that if this doesn't work, what could be the next step? What are issues like donor egg, surrogacy, embryo adoption, traditional adoption, and people haven't thought about all those, but it always helps to have a plan B. No matter what stage of the infertility process you're in.
hmm.
So there are all ways that can help propel people forward.
You've mentioned a few of the benefits of counseling, and it's just the counseling. Just I love the way you just said that, but just putting words to your feelings and helping process through them can be
Mhm.
so beneficial. What does if someone comes to you for counseling? I assume it's just not like a one-time thing, correct? Is it sort of a process of multiple sessions, or how do you walk through that with patients?
I think it's different for everyone.
Hmm.
Uh, some folks just need to get in for a few sessions and speak to their concerns. Other people, especially if they have had pre-existent issues in their lives, or certain areas of dysfunction emotionally in their lives, it becomes more complicated. So that could be a longer term process.
Hmm.
In addition, I mean, if someone has a major depression or, described anxiety disorder, or panic disorder, that needs treatment. Therapy is is one option, but in truth, some women need to be treated from a more psychiatrically oriented way. Some people need medication, antidepressants, for instance,
Mm-hmm.
because again, these fertility drugs can unmask psychiatric disorders, or women can come into the infertility process with psychiatric disorders, and these need treatment. And I always say to women, let's take care of the issues first, so that we're not in the middle of some infertility process and we're behind the 8 ball already, because you're already into the process. Let's try to take care of as much of this as we can before you move into more intensive infertility treatments and interventions.
Yeah, that makes a lot of sense. We're close to wrapping up our time with Dr. Katherine Atala, who is with our psychiatry and behavioral medicine department, and she specializes in speaking with couples and partners about the emotional impact of infertility. And as we wrap up, just had another question just related to, maybe if one partner wants to go to counseling and maybe the other partner is reluctant, is it something that it's required for both parties to be present, or could someone come to you on their own in regards to this?
That's a great question. And actually that circumstance does come up, because it's important for the couple to be on the same page
Mm-hmm.
regarding their vision of what this whole process is going to look like going forward, in the midst of all this uncertainty. So many times the woman wants to be seen, but the male partner is more reluctant. That would probably be the most common
Mm-hmm.
scenario. But I tell women, go by yourself if he doesn't want to come, because emotional health can be contagious in a sense.
Yeah.
Emotional improvement can be contagious. So if one person is going and it's helping, you can't help but help the other person,
Yeah.
because that improvement will move into the relationship, and it will move into the other partner. So yeah, sure. I think that everyone can exercise that option of going, by themselves if the partner doesn't want to go. It can't hurt, and it certainly can help.
Yeah, that's a great way to frame it. That I think, and can only help. And I just appreciate all of your insight today, Dr. Atala.
Oh,
And
my pleasure, Justin.
sharing this information with us. You know, to our listeners out there who might be listening to this episode, please feel free to share it with any family or friends who you think it might be beneficial for. And everyone listening, if this is you or a family member that might be having an impact emotionally because of infertility during this season of their life, I just encourage someone to reach out. Go ahead and call us and see about just setting up a session for talking with Dr. Katherine Atala or one of her colleagues. If you just go to wakehealth.edu and search psychiatry, behavioral medicine, the list of providers will come up. And she mentioned earlier that they're at the Jonestown Road location here in Winston-Salem, but there are resources available throughout our Wake Forest Baptist Health organization. Or someone can call 336-716-WAKE and ask for the appropriate department, and they'll be able to guide you to the right location for an appointment. So just want to offer that information out there as we close up. Dr. Atala, thanks so much once again, and I hope that you come back and visit us at some point in the future as well.
Thank you so much for having me, Justin, and I'm very pleased to be able to shed some light on this.
Yes.
Subject.
I am too. So hopefully someone out there listening, this was for you. So everyone, thanks so much again for taking the time to check us out. Visit wakehealth.edu/podcast for other podcast topics. And until we talk again, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.